Welcome, everybody. My name is Margie Siegel. I'm the director at Benefits Minnesota, and this is the 2023 webinar presenting Benefits Minnesota to MCN members. Welcome.
Hi, everyone. My name is Jack Duffy. I'm a benefits consultant and market leader with Gallagher. I had the pleasure of partnering with small and large nonprofits throughout Minnesota.
Welcome, everyone. My name is Caleb Goldberg here with Gallagher. I am a play benefits consultant that primarily focuses on partnering with nonprofit organizations, and I also help lead Benefits Minnesota. Today on the webinar, we are going to give you an overview of Benefits Minnesota and what it is, providing some updates on enrollment, talk more in detail about the plans and networks, provide a few case studies of groups that have recently joined, talk through some of the additional value adds that you can access when you are a Benefits Minnesota member, talk through some of the administration solutions we've been able to implement, and then we'll finish up with the timeline and next steps for interested organizations. So as an association health plan, Benefits Minnesota pools the purchasing power of nonprofits across the state to access high quality, cost-effective healthcare. This helps your organization attract, retain, and reward employees, and overall helps you deploy more dollars back to your mission. There are four main organizations or players involved in Benefits Minnesota. The first being the Minnesota Council of Nonprofits, which is one of the largest state associations of nonprofits in the US. Second is us at Gallagher. We are an industry-leading insurance brokerage and consulting firm with a focus on partnering with nonprofit organizations. Medica is the carrier of all the plans, so they are one of the largest nonprofit insurance carriers. And the last is a new addition for 2023, that is Capstone Administrators. So they were introduced at the beginning of this year, and they help create and support a streamlined billing, enrollment, and eligibility management process. Benefits Minnesota launched on January 1st of 2020, and as we approach our fifth year of operation, Benefits Minnesota continues to gain momentum and grow. So to date, there are just over 125 member organizations. From this, there are over 1,100 insured employees. And when you include family members, there are over 1,700 insured members. At this point last year, we were just around 100 member organizations. So, a lot of growth within the last 12 months. Roughly 50% of organizations in Benefits Minnesota are offering health insurance for the first time. And these members, I guess all members, vary in size, location, and mission. So, we have groups that are around 2 employees all the way up to right around 100 that are both in the Twin Cities or greater Minnesota. So really anywhere from, International Falls to Rochester or Duluth to Mankato, and the missions of all sorts, whether that's human services, arts, environment, etc. While roughly 75% of members have 10 or fewer employees, Benefits Minnesota is a fantastic option for both small and large group organizations. And I'll explain what I mean by that in a little more detail here. In the state of Minnesota, the health insurance market is really split into 2 segments: the under 50 full-time employees and the over 50 full-time employees. These are referred to as the small group and large group health insurance markets. But regardless of size, all nonprofits are eligible to join Benefits Minnesota. But depending on where you fall in the under or over 50, your value proposition will look a little different. In the standard small group health insurance market, the premiums are community rated and state filed, meaning your utilization and your claims have a much smaller effect on your pricing. Benefits Minnesota allows groups to be broken out of that standardized pricing, and Medica quotes each group through the lens of the overall pool, looking to provide the most cost-effective coverage. And while similar to the small group, the value proposition for large group employers is just a little bit more unique.
Thank you, Caleb. So we have about a dozen large groups in Benefits Minnesota today. And that is increasing at a much faster pace than when we started Benefits Minnesota a number of years ago. And that's for a few different reasons. First of which, there's potential for immediate cost savings relative to what organizations are paying for group health insurance. There's also potential for future cost savings. But the next couple of points for me really do it justice. That's increased security and sustainability relative to your finances. On the open market, large groups are seeing increases between 15 and 25%. In some cases, worst case scenarios, 29 or 35%, depending on the carriers that they partner with. Seeing those, 1 year is difficult enough, but a lot of organizations see those 2-3 years in a row in some instances, and that's just not sustainable. That really hinders your ability to attract and retain talent. And we're here to provide a high quality, right, a viable solution for nonprofit employers that allow them and really enable them to compete for talent in Minnesota. So the formula and how we get there is similar, but there are some nuances that make Benefits Minnesota different than the open market that we believe give us some increased competitive nature. In some instances, Benefits Minnesota can be that reset or that restart for a large group that has had a history of claims and utilization that is higher than they would want, right, or higher than the carrier would want. In the open market, often those rates, those premiums that the employer and the employees pay aren't walked back when the demographics change. Benefits Minnesota looks at a real snapshot of the organization in the present state and doesn't ding you in a negative manner for years and years of utilization that isn't directly represented with the population that you have today.
When we focus on the specifics of Benefits Minnesota, there are 5 core plan designs you can offer and pair across various networks. The plan designs will vary in both deductible and HSA compatibility, and we're extremely proud to share that these plan designs have not changed since the inception of Benefits Minnesota, and they will be staying consistent into 2024. Now, looking at the networks, the utility of each of these will vary based on your location within the state. Medica offers their open access network in the form of the Passport. So this is a national network, includes 100% of hospitals, roughly 99.9% of clinics. So this is great if you have employees in other states or you have family members away at college. They will be able to get access or access care through this network. The other networks you see listed here are ACOs, or often referred to as narrow networks. But the idea behind these is by focusing your network of providers, you are able to receive more detailed care at a lower cost. As I mentioned, these are going to be regional networks within the state. So the most compatible networks for the Twin Cities metro area are going to be the Advantage Plus, Elect, and Clear Value. Then once you get into greater Minnesota, the Essentia and Complete Health will be more compatible. We do have a few case study examples to show these plans and networks in action and how they're helping employers offer cost-effective and really just cost-effective healthcare and really enhance their employer value. The first example or case study I want to start out with is an organization here in the Twin Cities. They have just around 20 employees. They were previously with a regional carrier and were offering just one health plan on one network. Their reason for joining Benefits Minnesota was partly due to the cost savings they were seeing on their premium, but there's a little bit more to the story. They were able to not only cut costs, but offer much richer plans and provide more flexibility for employees. So they were able to introduce 2 lower deductible plans, 3 lower deductible plans, all while saving costs. So not only are you getting a richer plan, you're seeing a lower monthly premium. There is one other reason that they joined that I'll explain in a little more detail later in this presentation, but they were offering an HSA eligible plan. With Benefits Minnesota, they were able to implement a program that allows employees to earn some dollars that go directly to their HSA.
The second case study we wanted to feature is from a large group. As I alluded to before, the reset or the restart of an organization's utilization and claims. This organization had experienced 3 years in a row 29% increases in the cost of their group health insurance with a national carrier. Now, that is not sustainable. That does not enable the organization to attract and retain its employees as a leadership team had wished. When a high claimant left the organization, the current carrier did not hit reset or did not restart and look at a real-time snapshot of their claims and their utilization. Benefits Minnesota was willing to do that. And based on that, for the same plans and comparable networks, the organization was able to save $10,000 a month. Think about how an employer can reinvest those dollars into their organization. That could mean 1, 2, 3 new hires. That could mean external and internal trainings. You know, recouping those dollars for your mission and putting it back into the people in the communities that you serve. I mean, the limitless possibilities when we're talking cost savings of that size and substance. In addition to the plan designs being the same, the networks being comparable, and the cost savings that was had, we were also able to ramp up or make more robust the communications of the benefits to employees. I'm a true believer that when employees understand their benefits, when they're communicated in a manner that resonates with each individual employee, they're going to appreciate those benefits more. And that might lead to utilization. That's the utilization that we want. We're going to catch conditions early, and we're going to take care of those conditions so they don't turn into something much bigger than what they have to. To Caleb's point from before, an interesting nuance with this organization as well, is that they had high deductible health plans, but they did not have an employer contribution to HSA accounts for their employees and or the employees' dependents. With the addition of My Health Rewards and allowing employees to earn dollars into their HSA, right, that is some way, shape, or form attributed to the employer. And they receive that credit from the employees, right? Or think of the employer when those dollars hit their HSA accounts. So wins across the board for this case study, and one of the reasons why I wanted to share it.
The last example I'll discuss here is kind of similar to the first example, but it is an organization that's in greater Minnesota up north. And they have a similar reason to joining Benefits Minnesota as the first example. So they were seeing a slight reduction in their monthly costs, but able to offer more flexibility and enhanced plans to their employees. And the reason we really want to show this one is that, you know, Benefits Minnesota isn't only designed for the metro area. There are organizations across the state seeing cost savings, seeing value, and being able to introduce ACOs or narrow networks that their employees are able to take advantage of.
I hope as you listen, you're writing down some questions maybe that you have, or if you're coming up with things that you're unsure about, just know that we've got lots of ways for you to reach out to people for answers, and we'll be sharing more of that contact information at the end, but go ahead and keep track of those questions along the way. The eligibility requirements. So for an organization to be able to consider joining Benefits Minnesota, they have to have a headquarters, a principal place of office of operations in the state of Minnesota. They have to be a 501c member of Minnesota Council of Nonprofits. And if you're joining only to learn about benefits, you have to be a member for at least 30 days. That's what that next bullet is. So you could join today, for example, and then you would be able to explore the benefits and see a proposal from Medica and Gallagher in about 35 days. And you have to have 2 or more benefits eligible employees, which means each organization can set what their eligibility level is on its own. So each organization can say, in order to be eligible, employees need to work 20 hours a week, 25 hours a week, or 30 hours a week. Those are the 3 levels. And you only need to have at least 2 employees who meet that eligibility criteria. And both of those employees do not need to participate in Benefits Minnesota. You'd be priced as if they were both joining, but only one would actually need to take advantage of the benefits if that worked. So we have many organizations that are quite small, and many of the staff people get their benefits through their partners or maybe their parents or other avenues, and they choose not to join Benefits Minnesota, but some staff then will still be able to participate if they choose. The part about the Benefits Minnesota eligibility that ties back to the Minnesota Council of Nonprofits, or MCN membership, is that for Benefits Minnesota, all of the renewals happen on January 1. So every January, there would be a new kind of set of plans and sort of opportunity to change plan levels for different employers and employees. And with that January 1 renewal that's in force for Benefits Minnesota, we would automatically need to sync your MCN membership up to that calendar January 1 year. So for some groups that who maybe have an MCN membership that renews in May or June, we would prorate a year of the membership to bring things in line with that January 1st start date. I mentioned about the employee eligibility on a few moments ago, but that's some flexibility that we're glad to be able to offer organizations. And the other piece about eligibility and participation is when you bring in new employees, you are able to set the waiting period that you want to have in place for those new employees. So that can be start of employment, or 30 days past that first start of employment, or the first month after 30 days start of employment, and so on. So organizations have a variety of different ways of setting that up, and your Gallagher representative, salesperson would be able to help you, design the best plan and parameters for your organization.
Beyond just the dollars and cents of the health coverage that Benefits offers, there is much more value included in the program, and that's through a variety of other kind of point solutions or programs. I'm going to highlight a few, starting with the My Health Rewards Invest. That's the HSA program we already alluded to, and I actually have more details on the next slide. Medica does offer an employee assistance program, and this is really designed to provide lifestyle support for things like, mental wellness, stress relief, anything along those lines. It also includes 5 counseling sessions. The next one I'll mention is Able To by Self-Care, and this was originally known, or formerly known, as Senbello, but this provides on-demand support for things like stress, anxiety, depression, anything else with your mental health journey. Ovia is a benefits platform designed to help families with pregnancy and family planning. And then lastly, organizations do have access to the Optum employer trainings, which will include a variety of topics such as workplace skills, management development, physical, emotional, financial well-being. So organizations are able to choose from a library of trainings and offer those to employees. Back to Medica My Health Rewards Invest. Employees that are on an HSA plan are able to earn up to $75 per month by simply tracking a variety of different health metrics. This is oftentimes things that they are already doing. Annually, that's up to a $900 contribution to your HSA, which is a very meaningful amount of money at the end of the year, especially when you're considering the IRS limits. The contributions are paid out on a quarterly basis, but you do earn them monthly. Please know that this does not come with an additional cost. If you were with Medica standalone and you wanted to implement this program, there will be a per employee per month fee for it, but within Benefits Minnesota, it is included complimentary. Going back to my previous comments on some of the new administrative solutions for 2023, we did begin the partnership with Capstone and their services.
Right, so Capstone is a third-party administrator, TPA, that now provides for Benefits Minnesota the enrollment and billing administrative services that happen on a monthly, well, the billing happens on a monthly basis. Enrollment happens primarily in the fall, but depending on what all is going on for an organization, can occur during the year too. And many organizations join during the course of the year, so I don't want to confuse things on that. And we've been really very satisfied with Capstone services. So far, they've lifted a big burden for Benefits Minnesota and really helped keep things running smoothly all the way through.
The next step for interested organization is to visit our landing page and request time with us or reach out to us individually. From there, we'll talk specifically about your organization and how Benefits Minnesota can fit with you, and then eventually evaluate your options. So feel free to reach out to us and we'll follow up with you to schedule some time. Once we are able to submit your application, Medica will turn a proposal around within 10 business days. And we are fortunate enough to be in quoting for January 1st of 2024. So now is the time, as you are either just receiving your renewals or awaiting those, to begin planning for 2024. Here is our contact information. Please feel free to reach out to us in any of the methods I've described. But again, thank you all for taking the time today.
Thanks for being here, everybody.
Thank you.